Hi guys, so in this video we'll be talking about PRP and treatment, so what it is and when to use it and how do we go about it. So PRP stands for platelet-rich plasma, and it's classified as a regenerative therapy that can be implemented when your horse has a soft tissue injury, so an injury like a tear within a ligament or a tendon, more specifically when we are dealing with a core lesion, so a lesion in the center of the ligament or the tendon, rather than a lesion in its borders. In that case, it might actually not be appropriate. The main goal of this PRP treatment, or any regenerative therapy, is not so much to target only the pain, although it can also do that, but to just increase the chances of us having normal, healthy fibers being created afterwards and covering the defect within the soft tissue that we're dealing with, and therefore decrease the chances of a re-injury during the rehab and physio plan afterwards. So in this video we will show you how exactly do we go about it, and you will see that it's actually a quite simple or straightforward procedure, and hopefully by the end of it you will understand a little bit more about it.
So the first step will be to sedate the horse, so the horse is calmer and doesn't move as much during the procedure. Then our nurses will clip a patch of hair in the horse's neck over the vein that we will be using in a short while, and they will also clip the leg where the lesion is to be injected, and they will clean it and prep it so both areas are as sterile as possible, so as to decrease the chances of contamination afterwards that could lead to an infection in the injection site. Afterwards, we will be scanning the horse's leg to determine the optimal place to inject the horse, and once we know that location, we will just apply a little bit of local anesthetic in the skin level. So when we are injecting the needle afterwards with the solution of enriched plasma, the horse doesn't move as much and doesn't feel it as much. We will prepare everything in a sterile manner using sterile gloves, and you will see in a second that in this little bag we will be putting a sample of the horse's own blood, and that's an advantage of this procedure, is that we only require a blood sample rather than, for example, a bone marrow as we do with other types of regenerative therapies. We will be collecting roughly 50 mils of blood, which sounds like a lot, but actually it's a very small amount of blood for a horse. We will mix that blood with a couple of solutions that are also sterile in the upper bag that you see in this video, and afterwards we will let that solution run through that disc that you see in between the bags, and that disc will act as a filter for the platelets that the horse naturally has in his plasma. We will need to carefully mix the blood well with the pre-prepared solutions, inverting the bags several times gently, and then we will be rehanging the bags in the metal hanger. We will be opening up the clamps that are preventing the blood from running freely, and you will see that the disc will immediately get filled up with blood, and the blood will flow to the bottom bag. We will be interested in the part of the blood that stays in the disc, it stays in the filter, because that is the sample that will contain the enriched platelet plasma, or the plasma enriched with platelets. We will then go back to the horse, and under ultrasound guidance we will inject the needle into the lesion, so we want the needle to be actually as centered in the lesion as possible, and we will inject a small fraction of the sample. So usually we will get 8 mils, only a fraction of it goes into the horse's lesion, usually around 0.5 to 1 mils per injection location. And you can see in this ultrasound scan the needle is that white straight line within the lesion, ready to be injected.
Okay, so this is pretty much the entire procedure we will have to go through. After this, your horse will be going home with a bandage in place, and he will require antibiotics and anti-inflammatories for a few days, and then we will be rescanning him 8 weeks later, at which point we will hopefully already see a significant improvement in the lesion. That was it for today. Thank you for watching.